Well, I want to thank everybody for joining us. And before I begin, I want to acknowledge we've been joined by two of my distinguished colleagues from the City Council, both Councilmember Adrian Adams, who's now the new Public Safety Chair. Congratulations. We're also joined by our Queens Delegation Chair, Karen Koslowitz. Thank you for being here, and I miss you both dearly and miss the delegation. But we're off to the races and got some new challenges, but it's all good. I also want to acknowledge all of our district managers and chairs who've joined us from each and every one of our community boards, and I want to thank them for the work that they do daily. It's not a job where you expect to get a lot of thanks, but we thank you for what you do, certainly, and keeping Queens strong in all 14 community boards. I'm not going to belabor this because we have a special guest today from the Department of Health. And now let me just go through. Today was a historic day for Queens. And let me just say this, although it was a historic day for Queens, does not mean that you should not wear your mask and continue to social distance and also to limit gatherings, all right? So I know everybody's excited about the vaccine. And I know it's been a very busy day for our health commissioner and getting the ball rolling on that. I also want to say just a fun fact, Queens was the first place in the United States to have this vaccine administered. So that's a fun fact. Come on, Queens.
Yay.
And also another fun fact is the Dr. Michelle Chester, who administered the vaccine to Sandra Lindsay, is a Far Rockaway High School graduate, it's been reported. So yay to my old council district, but yay to all of Queens. Let me get serious now, because we certainly were hit the hardest during this pandemic, and we were the epicenter of this pandemic. So today is certainly welcoming news. And we look forward to working with the Department of Health. And just so you know, the Department of Health has a $1.6 billion budget and more than 6,000 employees throughout the 5 boroughs. The New York City Department of Health and Mental Hygiene is one of the largest public health agencies in the world. This agency's work focuses on the inspection grades of dining establishments, the low to no cost health clinics in our neighborhoods, and the birth certificates for our youngest New Yorkers. Furthermore, they study the patterns, causes, and effects of health and disease conditions in New York City neighborhoods. These studies shape policy decisions in the city's health agenda. With us this evening is Dr. Dave Chokshi, the Commissioner of the New York City Department of Health and Mental Hygiene. Dr. Chokshi will deliver a report on how the agency is dealing with the ongoing COVID-19 pandemic. Welcome, Dr. Chokshi. Please begin, and a hearty Queens welcome, because he is a Queens resident as well. So I know he has Queens on his mind a lot these days, and I want to thank you for the work that you're doing, which is no easy task. But one thing in Queens is we follow the science, and we know that you're doing it. So I look forward to the work ahead, and we look forward to the questions from many of our guests today. So thank you so much. Dr. Chokshi, please take it away, and congratulations.
Thank you, sir. Thank you, Mr. Borough President. I have to say, your remarks covered a lot of the ground that I was planning to, and you said it so well with respect to our public health messages and our guidance. So I shouldn't be surprised, because you've been a real champion for health, but particularly during this public health emergency. So I'm grateful for that. I'm really grateful to have a little bit of time with all of you in what is a historic moment, yes, and what remains a very challenging moment in so many ways. Let me start with just a little bit from the heart, which is, as Donovan mentioned, as the Borough President mentioned, I'm a Queens resident myself. I've been in Queens for 7 years, living in Jackson Heights, really the border between Jackson Heights and Woodside, just a few blocks away from Elmhurst Hospital. And so, along with all of you, I have really lived how tragic the last few months have been in too many ways for our community, for our neighbors, for our friends, for our family members. And we remain in a precarious position which I'll go into a little bit more detail about. But I also know this about Queens. Along with our incredible cultural and ethnic diversity comes an incredible strength, which we've also seen time and time again during the pandemic, and that we'll have to continue to marshal. And that's why I felt genuinely so proud when I saw the first vaccine in New York being administered in Queens by someone from Queens, and two people who have been taking care of our fellow community members as well. So look, here's my big message. We now have a light at the end of the tunnel in the vaccine, but it doesn't make the tunnel any less perilous. And we have to look back to what has worked over the last few months. All of the things that we know helped us bend the curve first in March and April, and that has helped us, keep the virus at bay for several months until the last few weeks. And those are the things that the borough president has already mentioned. It's about wearing your mask, staying home if you're feeling ill, washing your hands, keeping your distance, and getting tested as well. And the reason that we have to look back on that is because that's what's going to help us look forward. But in order to do that, we have to get through yet another very difficult phase that we find ourselves in. When I look at the data, and particularly for Queens again, we're seeing significant increases in cases. The percent positivity for the borough now exceeds 6%. And unfortunately, the most severe outcomes that are born in the most difficult way, hospitalizations and deaths, are also starting to increase. So what I'm hoping is that together, because I know all of you are leaders in your communities, we can be the right messengers, because I know how hard it is to maintain the discipline and the vigilance that we need. I know everyone is tired of this virus, but unfortunately the virus is not yet tired of us. And so we have to do those bread and butter, those fundamentals that I talked about, and then make even more difficult decisions like what we saw, around our holiday guidance. I know it's not an easy thing to ask people not to gather with their loved ones, not to have, parties and celebrations reflecting on this year, particularly given how difficult it's been. But we have to redouble our efforts along all of those dimensions. Now, let me just give you a little bit more in terms of a vaccine update, if I may. And then we'll take the borough president's direction about any questions that I can answer. So I'm sure you're all just genuinely excited to hear about the vaccine. And I have to say, I visited with some of the teams at NYU who were getting the first vaccine earlier today, and my heart just lifted. It is really a shot in the arm, a shot of hope. And I think it's particularly fitting that the people that we have relied upon over the last few months, the nurses and doctors who are fathers and mothers themselves, who have sacrificed a lot for the purpose of taking care of our mothers and fathers and grandparents and everyone else who has needed care. And so it really just gave me succor to see the moving, event of people starting to get vaccinated in New York City. But as we talked about, we can't let our guard down. You don't throw the oars out of the boat during the storm just because you see the shoreline. But let's talk a little bit about what we anticipate over the next few days and weeks. And then I know Dr. Long is here for some test and trace updates as well. So first, just to recap, because it's been a very busy few days for the vaccine. Over the weekend, both the FDA and the CDC, the two federal bodies that are most important with respect to authorization for the vaccine, they both officially moved forward with the first vaccine, that's the Pfizer vaccine, that began to ship to healthcare facilities throughout the country yesterday, 5 hospitals in New York City got the vaccine today, 37 will get it tomorrow, and 2 more will get it on Wednesday. And that's just the Pfizer vaccine. There's another vaccine known as the Moderna vaccine. We're expecting that the FDA will likely authorize that in the coming week as well. And the first doses could be distributed as early as next week, which is the same time that we'll start to see our nursing homes and other long-term care facilities start their vaccinations in addition to the hospitals, which are starting this week. Let me tell you a little bit more about both of these vaccines because, as the borough president said, we always follow the science. So here are some of the facts that I want to make sure you're equipped with and you can convey to all of your constituents as well. Both of these vaccines are mRNA vaccines. Basically, that means they teach our cells how to trigger an immune response and build immunity to the virus that causes COVID-19. Importantly, mRNA does not affect with or interact with a person's DNA. In fact, the cell breaks down and gets rid of the mRNA as soon as it's finished using the instructions that it provides to build up that immunity. So that's how the vaccine works. Let's talk a little bit more about distribution. As you've probably heard by now, the supply of the vaccine will be limited, particularly over the coming days and weeks. And so it'll be distributed in phases to groups of people based on their risk of COVID-19 exposure, as well as the severity of the illness they may experience if they are exposed. That's why healthcare staff at high risk of exposure are being prioritized first. And then other healthcare personnel, including nursing home staff, but also nursing home residents, will be next. And then the next phases will involve essential workers, particularly those who find it difficult to physically distance. And then the people who are most at risk, older New Yorkers, individuals who have underlying medical conditions, and others who are at greater risk for severe COVID-19. I want to be very forthright with you. This process is going to take time. You know, what I said this morning is that, yes, the cavalry is coming, but it's going to be a slow and steady march for them to actually arrive. We don't expect that the vaccine will be broadly available to the general public until mid-2021 at the earliest. So just one final note, and then I'll conclude. We're working to ensure that getting the vaccine will be easy, free from barriers such as cost and immigration status. And again, the most important thing that I can give you is the knowledge to say these vaccines are safe. You know, as all vaccines that end up getting authorized or approved by the FDA are. And every indication that we have is that it helps avoid the illness that comes along with COVID-19. So with that, I'll turn it back to you, Mr. Borough President. Thank you again.
Thank you, Dr. Chokshi, for that presentation. And I guess I'll start with just 2 questions, and then I'm gonna get to the rest of my colleagues. And I want to thank you once again for your communication with the office, with myself over the course of the last few weeks. Always great to have someone who's open and honest when having tough conversations. And I want you to know I value that and appreciate that. Just 2 questions on the vaccine. Let me start with, you know, there's sort of been a sordid history with vaccines, specifically, especially for communities of color. And I wanted to know, especially in light of many of the communities that were hit the hardest in Queens, you know, what's your plan to shake or to gain confidence, to gain the public's confidence in taking this? What's your plan in working with local leaders, perhaps our community boards and others, validators who can certainly be out there, you know, promoting why it's so critical to use this vaccine? Are you looking at doing any PSAs, for instance? And then the second question I had is just you know, and of course, unlike the White House here in Queens, in this president's office at least, we're not looking to be vaccinated first. We want our essential workers to be vaccinated, those on the front lines, and then obviously the individuals who you know, who are elderly and who can obviously who obviously could be hit hardest by the virus. In terms of that, so I just wanted to know, what are you thinking in terms of distribution there? And then also from an equity standpoint, when you talk about access, when you look at communities like Jackson Heights, Corona, East Elmhurst, you look at Far Rockaway, the communities that have historically dealt with a myriad of disparities, you know, how are you prioritizing them after you get through prioritizing those who are on the front lines and who immediately need the assistance? So those are the three questions, and then I'll turn it over to my colleagues for other questions.
Well, thank you for those really thoughtful questions. I know you and I have spoken briefly about this before. I know how much this is something that you're really passionate about and concerned about, for the people that you're representing. Here's what I can say. First, we have from the mayor down, a very explicit commitment to ensuring that equity is a key part of our plan to roll out the vaccines. The way that I think about it is trust is a key ingredient for turning a vaccine into a vaccination. That's something that I've experienced myself in the exam room when I'm taking care of patients. They're far more likely to engage if it's someone that I built a relationship with who trusts me because they know that I care about them. So I think we have to bring that same spirit into what we're doing at the city level, at the borough level, at the population level in this way. Our commitment is to try to make equity real by starting with humility, frankly. I think that's the right way to think about it, to say that, it's not just about the information that we can provide, not just about the logistics of delivery and distribution, but actually saying this isn't just about the health department or even all of city government. This is all hands on deck, and we want to enlist all of you because you are the ones who have the trusted relationships in your communities. Whether you're community leaders, as all of you are, or working with faith groups, as we have for our flu vaccination campaigns in the past, or those local clinicians who have been taking care of their own patients, for many years. What we want to do is to say that the starting point is to work through those trusted relationships that already exist, because that's the most effective way that we're actually going to make equity real and bring the vaccine to the hardest hit places in Queens and beyond. The mayor has charged us with making sure that the priority neighborhoods in New York City, the 27 priority neighborhoods, which include places like Jamaica and Corona, are central to how we're thinking about, the broader phase of distribution. So it will, again, take us a little bit of time to get from now to where we're able to operationalize all of that. But you have my commitment that that'll be a key part of our effort. But more importantly, we'll need your help to make that real.
Thank you for that. I'm going to go to my colleagues. I'm going to start with, I'm going to do this on seniority. So we'll start with if the chair of our delegation has any questions, comments, or concerns. Karen Kosowitz.
I want to know, eventually, will doctors have it in their offices?
Yes, thank you for the question. The answer is yes. It will be made available any place where you can get a vaccine today, whether it's a flu vaccine or a different type of vaccine. That includes, not just hospitals and doctors' offices, but also pharmacies, community health centers as well.
Okay, is there any time frame that you would think this would start happening?
It's a good question. So much depends on the supply that we'll be getting from the federal government. And I'll be, honest and forthright that there are still some question marks there. My best estimate is that starting, later in January, February, March is when we should anticipate that wider distribution beyond the initial places that I described.
Thank you very much.
Thank you. I'm going to go to my colleague, the new chairwoman of the Public Safety Committee, Councilwoman Adrienne Adams.
Thank you so much, Mr. Borough President. And again, to reiterate how very proud I am of you. Dr. Chokshi, a pleasure to be on this meeting with you this evening. And thank you for the call when you were first named to this appointment. I congratulate you for that. Just a couple of things. You know, I chair the Black, Latino, and Asian Caucus, co-chair it also. And just for messaging purposes for communities of color, I think that it's really important in your messaging that it is known that that a Black woman was actually instrumental in the development of this vaccine. For me, it made a lot of difference in the way that I am presenting the messaging, you know, of the necessity for this vaccine. The other thing is I speak to you as one who has lost her father in May to coronavirus, unbeknownst to us. We thought he was suffering with congestive heart failure symptoms, and it turned out that virus, you know, rode in under the disguise of his symptoms for congestive heart failure. Actually, might have been a neighbor of yours, a resident staple of Jackson Heights, but he did pass away at LIJ. So with that said, the issue of equity, again, to echo the borough president's sentiments as far as equity is concerned, and someone like my dad and others, I'm just curious to understand the difference in the tale of two cities between the remedy for, say, the Trump administration and those of us that have been waiting for this vaccine. There was a particular cocktail where, you know, members of the Trump administration, Donald Trump himself, in a matter of hours, oh, I feel great. I feel great, it's nothing. You know, and we all know that, you know, the devastation of this virus. What is the difference as far as the equity is concerned, and why couldn't the general public have access to the same remedy that the Trump administration had access to? And I'll stop there. And thank you again.
Well, first of all, thank you. And of course, I'm so sorry to hear about your father. I offer you condolences, and to your family as well. And each, you know, what we have seen over the last few months can, with each of those numbers, you know, you can unfortunately become numb. And so I thank you for your courage in sharing a story that that moves us and that makes us realize how, you know, how each infection, you know, each case is really a tear in the fabric of a family, a community. And so, you know, I'm sorry, and it is certainly something that I try to hold in my heart, even as we take on, you know, the challenges that we have to confront moving forward. And it I think connects very much to your questions, you know, about equity and making sure that we're thinking about it in a way that acknowledges the context, you know, the reasons that we have this deep-seated distrust, which too often we think about as only historical. But to your point, you see, you know, what has happened with respect to this difference in access to therapies, you know, the antibody therapy in particular that you're talking about, and they're fresh wounds, you know, they're not something that we have to look back over decades to understand. And so what I can say is that, you know, it is something that we are actively monitoring, you know, with respect to when a new therapy comes out, how do we make sure that New York City, and particularly the people who have most suffered in New York City, are as close to the front of the line as possible. We've done it, you know, again, I'll acknowledge Dr. Long, who is on the call. We've certainly, you know, made strides in addressing some of the disparities that existed in access to testing, for example. And, you know, that is something that we'll have to continue to strive to improve, because the honest answer is that we haven't come far enough, whether it's around, you know, access to therapies, and making sure that that same approach is brought to bear for vaccination as well. You know, one concrete thing that I will tell you, and I'd like to give credit to Dr. Torian Easterling, who's my first deputy commissioner and the chief equity officer at the health department. You know, one thing that he has made a real point of emphasizing is that it's not it's not only about place, although that's very important. It's also about representation. And that gets to the first part of what you were saying in your comments as well. And so we want to, again, work in partnership with people who can deliver the message, frankly, in a different way than I can to certain communities. And so that will be part of our commitment as well.
Thank you for that. Thank you, Adrian. And always rest in peace to your dad. He's such a great man. And a lot of people don't recognize, you know, often they look at elected officials as if we're like superheroes and we're not impacted by this stuff. But this is, you know, Adrian lost her father and still had to do her duty every day. And I remember her showing up to the committee meeting still and doing her job even through that painful moment. And she continues to do that. So I want to thank you for that. It's close to home. I'm now going to turn it over. And we've been joined by Dr. Ted Long, who is the Vice President of Ambulatory Care in New York City Health and Hospitals Corporation, and just wanted to thank him for joining us. I know he has to hop off, and I believe we'll have two individuals stay on. Laura Atlas will stay on his behalf as we move forward, who's the Director of Government Affairs. All right, I'm going to move to the next question. I saw a question from Community Board Chair 5, Vincent Okori. Go ahead, Mr. Vincent.
Yes, I'm sorry. Did I unmute myself? I can't. Yes.
We hear you.
2 points. One is a point of information and one is a question. In my other hat I wear is Vice Chairman of Wyckoff Heights Medical Center. And to address to Adrian's question, only your private physician could figure out which is the best cocktail for your particular treatment. So don't rely on anyone else. Your private physician knows your conditions, knows what's good for you. If you have it, they should be prescribing. My other point is, most of us in Queens have developed allergies because of the atmosphere, the aircraft fuel and all that. And the concern is that this current vaccine may have a problem with those of us with allergies. So doctor, what's the story on that?
Thank you for asking. This is a really important question because there's been, some conversation around allergies based on some early experience in England. And so I know it's been, a topic of conversation. Allow me to clear it up with what we know right now. And the FDA and the CDC, in their review of the science, they specifically took this up over the last few days. Here's the bottom line. Unless you have very severe allergies to a vaccine or another medicine that was taken by injection, the vaccine is considered safe for you. So if you have an allergy to a food, even an allergy to dust or something else in the environment, my recommendation would be to get the vaccine when it's your turn in the phases. If you do have any specific questions about this, or you're not sure about some of your allergies, I do recommend that you speak with your primary care doctor about it. But I want to clarify that the reason for pause is only if you have had severe allergies to a vaccine in the past or any other medicine taken by injection.
Thank you for that. I'm going to just go briefly to Dr. Ted Long to give some remarks. He's the Director of Test and Trace, and once again, also the Vice President of Ambulatory Care at the New York City Health and Hospitals Corporation. Welcome, Dr. Long.
Thank you for having me. I'll be brief here. I wanted to join to say thank you and to actually ask for your help. So I think, as Dr. Chokshi said, right now we see a glimmer of hope at the end of the tunnel, but now is the time where we need to work harder than we ever have before to sprint to that finish line where we get the vaccine and where it's equitably distributed across New York City. The reason I wanted to join you to ask for your help is actually, I'll start with an example with Borough President Richards. He may or may not remember, but he joined me at the Far Rockaways for an event where we got the word out to the community there about new rapid testing machines that we had. After he came, we had to bring in more machines because the line is around the block of people that wanted to come out and get tested. Your words to your communities are what keeps New York City safe, because our line of sight is our ability to test. Every time you go out and say the importance of testing, it makes an immeasurable impact and saves New Yorkers' lives. Because without testing, we don't know who has the virus and we can't do our contact tracing. Another example is in Breezy Point, we recently heard, and we saw the numbers were going up. We set up a new testing site last week in Councilmember Ulrich's office. After setting up that testing site, we had a flood of people that came in. It was immensely popular. And now things in Breezy Point, we hope are going to take a turn. In addition to that, today we actually are inside Breezy Point at the fire station. So if you tell us where we need to be to bring testing, you have my word. We will do everything we can to be there. We've delivered on that promise as much as I can, because at the end of the day, what separates us now from where we're going to be, where the vaccine fully takes its effect, is our ability as a city to come together and get tested and wear masks and pick up the phone when our contact tracers call you. But as I remember, Borough President Richards, I mean, it was very meaningful that day we spent together there. It made a huge impact. And again, we had to bring in more machines because of what you told your community that day. And we will bring more machines to wherever they need to be across the city. Just to give everybody a little bit of something to be proud of too. Testing again in New York City is what is keeping us safe, and it's what is keeping us safer than other cities that are struggling through the coronavirus right now. A couple of weeks ago, in a 1 week period, we tested 500,000 New Yorkers. 500,000 New Yorkers came out and got tested in 1 week. And I'll tell you, as a New Yorker myself, New Yorkers don't do anything unless they see a value in it. That 500,000 people believed that they were keeping their city safe. And if we get 500,000 people to come out and get tested every week, we will control this virus. What stands between us and doing that is our ability to work together to get people to come out. So please, I want to say thank you. And my ask and plea of everyone is, please help us to get people to come out and get tested. Reach out to me personally. If we could bring any testing sites to you, it'd be my pleasure to help you. I'm here to help you, but I can't do it without you. So I want to say thank you for everything that you've done. It is working. We just need to, we see that light at the end of the tunnel, but if we can double our efforts now, we will save New Yorkers' lives. And I'll say one final thing and then I'll stop. Another glimmer of hope for Queens. I'm very excited about this. When people are recovering from COVID, we treat COVID as a binary, you have it or you don't, but it's actually more complicated than that. The recovery can be long from COVID. And I'm very proud to be able to offer Queens a new first of its kind COVID Center of Excellence that's going to be opening in a matter of weeks in Jackson Heights. We're going to be getting the word out about this. We're going to be showing you the location, having walkthroughs, all of that good stuff. But this is something that we want to offer to the Queens community to help you, to help everybody in Queens and to help you recover, and to have your family members, if they've had COVID, recover from COVID as well. So again, we can, months down the line, we know we're going to be in a much better place, and we're going to have specialized care tailored to helping us all to recover. What we need to do to get there is just to do as much testing as we can and to get the word out. So anything in my power that I can do, please let me know. And I'll conclude by saying again, Borough President Richards, thank you, and thank everybody for helping to work together to bring New Yorkers out to get tested. Thank you so much. Thank you. Okay, we're now going to go, and thank you for your partnership in the Rockaways. I noticed it. So collectively, we can make a big difference. I think we had Dolores Orr, Chair of Community Board 14. Next question.
Yes, good evening. Sorry for no camera. My computer is very fickle. One time it works, next time it doesn't. So the Rockaways and Broad Channel has the highest concentration of nursing homes in the city. So I'm thrilled to hear that nursing homes is second on the list. I would like the city, though, to consider adding to the nursing home population as being second is the adult homes. We have a lot of adult homes, and they're located, both the nursing homes and adult homes are located in 11691 and 11694, and that's where we had our highest concentration of COVID individuals. I think adding the adult homes to the nursing population will help the city tremendously because that population is out and about. So they can easily be spreading and they're not always that has the capability to realize the impact of what they can have. So I would really appreciate that consideration. Thank you.
Do you want to add anything to that, Health Department or Dr. Long? And I will say that we're doing much better in that area. I actually toured St. John's over the course of the last few days, and you know, they had seen some slight improvements there. But I agree with you totally that we got to consider both. All righty.
Agree.
Yeah. I'm going to go to Betty Brayton, Community Board 10.
Thank you, Mr. Borough President. Thank you for scheduling these guest speakers for us tonight. It's very informative. I have a question for Dr. Chokshi. And first, thank you for the work that you're doing. One of the issues that the Borough President brought up and in Council Member Adams brought up, you know, this country has a long history of messing around with communities of color and medical experimentation and stuff. That is something we have to address as we move forward. And what Councilmember Adams said about trusted voices in communities and getting the message to people, I would urge you to explore and inform us as to how we can sort of do what we did in the census, being the voices out in the community, getting valid, correct information to people. Will you be able to put together, as this moves forward, a fact sheet on a regular basis that you can disseminate to the community boards so that we can disseminate it out to our community organizations and at our meetings so that people are getting accurate information? And the second part of my question is for Mr. Long. In terms of testing, we've come a long way in testing and it's absolutely great. But one of the things that I'm seeing is that we're not getting the weekly announcements of where locations are with enough lead time to get them out. It would be very helpful if we could get by Thursday or Friday what the next weeks are going to be. But it would also be extremely helpful if in every zip code in this city, and certainly in Queens because we're the epicenter, that in every zip code, there was one fixed location that can be well publicized and everybody knows. When I look at my board, the testing site at Lefferts Library is getting a huge turnout. And in my board, I have 4 zip codes and there is a library in each one of them. They would be definitely good spots to have a permanent testing site set up at the South Ozone Park Library in 11420, at the Ozone Park Library. And when I look today at the weekly numbers for up to December 11th, 11417 is top of the list. There's a library, and when you had the testing site at the 11417 Ozone Park Library, it got a good turnout. The Howard Beach Library also would be a good location, and that would put in my board area a testing location available to everyone in the district. And I'm sure other boards have the same situations. I realize not all libraries are open, but you know, certainly we ought to be able to work around that. So that's what I got to say. And I thank you all for what you're doing.
Thank you, Dr. Long.
This is Ted. I'll quickly start on the testing front. So I agree with everything you said. And thank you for, you know our history well in terms of our testing sites in your community. So 2 big things. Number one is we are trying to do as good of a job as we can with getting the right information out on the right timetable. So what I'd like to do is if I could follow up with you offline to send you where we're currently, because we're posting our sites in a couple of different places along with now wait times. Would love your feedback on how we can make that more clear and timely. So I don't know if you've seen our wait time part of the site. That's a new.
Yeah, I've seen it, but it's not easily accessible to everybody. And they're looking at all the different colors. They're not finding what they need to find immediately.
Gotcha. Okay, no, that's good feedback. So I'm gonna follow up with you to get more of your feedback if you don't mind. And
Sure,
then
I'll put my contact information in the chat. I'm in quarantine at the moment, so I'll give you my information. You can
perfect.
reach
So
me.
you'll hear from us. That sounds good. And then in terms of the testing locations, one of the things that we've done, which enables us to be more nimble, is we have a new model called a microsite model, where we can bring self-test kits with staff, and then you can actually take the kit, test yourself, hand the kit back, go on your way. You're done in a matter of moments. So I'm going to also follow up with you about recommendations for where we can bring those new sites. And that's what's enabled us to, for example, be so nimble going to multiple sites in Breezy Point in the last week alone. Very good.
Thank you.
Thank you.
Thank you, Betty. All right, we're going to go to CB6, Chair Alexa Weissman.
Thank you so much, Borough President Richards. I'm a super fan of Health and Hospitals and Test and Trace. You guys have been doing an amazing job, and we've worked really closely with you. And I want to commend you, especially. I'm also a little bit of a data nerd, so I really appreciate the upgrades on all the sites with, you know, the incomplete data for the most recent days. That's been really helpful in separating out rapid testing from like the full swab. I think has been giving more information. I also have more direct feedback, which I'm always happy to give, so I can just about some of the messaging. But my question for Dr. Chokshi or Dr. Long or someone else is about the vaccine in children and just the rollout and an update about that, because I know that, well, I don't know. I don't need to like speculate. So if someone else can tell me, that would be amazing. And just in terms of the indoor sites, we have worked really, you've been a great partner getting sites in CB6, and I really appreciate that. In terms of now that it's been getting colder, and I've talked about this with Laura Atlas, that I think Betty's ideas are really great. I've also suggested maybe partnering with landlords of some of the stores that are not occupied currently on main streets in different communities. But I think, you know, we've been told can you find an indoor site here, there, and I'm not really sure about like the risk factors for a store or a community group hosting a site. So if you could be really clear about, you know, because I don't know how open people would be to invite folks in to, you know, and I'd like just some clarity on what the risk is in terms of COVID exposure at a test site. So thank you so much. Thank you, Borough President.
Well, this said, I'll start. Well, thank you for your words, by the way, and I would love to hear your feedback. So I'll put my personal email in the chat here in a moment. I can't multitask. That's those days are gone. But I'll answer the first part of your question around testing sites, and then I'll defer to Dr. Chokshi or his team on the phone about the pediatric vaccines question. For testing sites, it's actually pretty easy to set up. We only need a certain amount of room so that you can have somebody go up, get the self-test kit, and be able to comfortably do the tests themselves there. I can send you more information. I'll put my email here for you to reach out to me if you don't mind. But it's pretty easy to do. And again, this week we just set up in Councilmember Ulrich's office. We're going to be back there. We're now at the fire department or the volunteer fire station in Breezy Point. So we can move around pretty well. The thing that's most helpful for us is honestly just where you think we should be. Then we can look into those locations. So I'll put my email here. We'd love to hear your feedback too.
Can I also just say quickly on that, on the sort of risk factor part, if you want to talk to the councilman's office about sort of what their experience was, we were invited to come back again. So I think they feel pretty comfortable with it. So I would definitely welcome you to do that. I would also just say when you're thinking about spaces, you know, it's easier to go to a space where there's already sort of a group there and we can just borrow the space for a day or two than to go to sort of a storefront where, you know, I'm sure there would be some kind of contract that they would want to very specifically lay out terms in. And so really we're just sort of, you know, crashing parties, I would say.
Great, thank you for that. We now have a question from CB3 Chair Renetta English. And if you want to ask a question, just hit the raise your hand function as well.
Sorry. Hi, how are you doing? My area is East Elmhurst, Jackson Heights, and North Corona. And you mentioned you're opening up a center of excellence. Where will that be? And what services will be provided? And then I guess the doctor may be off now. I want to know, how are those getting vaccines being monitored for any reactions and so on? So the Center of Excellence is something new I've heard about. I haven't heard about it before. What services are being provided and so on.
Great question. So again, I mean, as a primary care doctor myself, I'm at the Morrisania Community Health Center in the Bronx. You know, I've seen my patients come back to me with a variety of chronic issues, from chronic difficulty breathing to this odd symptom of I still can't taste or smell. And it's unnerving. And the unnerving part for me as a doctor is I don't know what to tell my patients in terms of how long it's going to take for that to come back. So we're still learning about the coronavirus. What I feel more confident in is we know pretty clearly the pulmonary and cardiology consequences. So what we're going to do at the Center of Excellence is you could think of it as a one-stop shop for everything that we know about the coronavirus. If you have a breathing issue, we're going to have on-site pulmonary function tests, the same as you may have done if you know anybody with asthma. It's the same type of machine where you check for, that's how we diagnose the right what lung condition you have, and are able to prescribe the right treatment for it. With on-site pulmonologists, of course, as well. We're going to have on-site echocardiography for the type of cardiomyopathy or heart damage that is specifically associated with the coronavirus. We're going to have a neurologic evaluation, as my patients are unfortunately going through with some neurologic symptoms like loss of taste, smell. And then we're going to have, importantly, comprehensive behavioral health on site as well. You know, this is something we cannot overlook in this crisis, is the mental health consequences of the coronavirus. For those that have survived the coronavirus, if you've set foot in the hospital, you're a changed person. And you know, you've seen things and you've been through things that I know from my patients are traumatic, and we need to be there for you for everything that you could be going through after with your recovery from the coronavirus. So we're very clear that behavioral health, in particular mental health, is really at the forefront of what we're going to be offering you when you come to one of our centers of excellence. But in sum, everything I said is a one-stop shop. We offer all of that on site for you, even the same day that we first see you.
So this will be at the hospitals, or this is going to be at a separate location?
It's actually at a separate location. We wanted to try to make it accessible, sort of easy to come in and out. It's going to be on 7117 Roosevelt Avenue.
All right. Thank you.
You're welcome. And look forward to it. Also, we're going to be providing comprehensive primary care with on-site mammograms, on-site DEXA scans, x-rays, even dental care with special air filtration methods to keep yourself and our staff safe if you could have the coronavirus too. So it's going to be it's going to have everything.
And can that information be sent to the community board so we could share that information with those in the community, please?
Yeah, we'd love to.
And will you need to have insurance? Do they ask about your immigration status? Can you just answer those two questions too, just for those who are watching especially?
Of course, sir. This is New York City Health and Hospitals. We treat everybody, no exceptions. And of course, if you don't have insurance and you don't qualify for insurance, we would love to enroll you in NYC Care, which is applicable at the new site and is now live in Queens too.
Great. We're going to go to Community Board 2 Chair Lisa Deller.
Hi, thank you, Borough President, and thank you, Dr. Long, for Dr. Long, for joining us. I have a quick question about testing. It is difficult to get people to commit to have a site, to trust that it's going to be safe if they're going to be a host site. But are you still doing, I mean, we've talked previously among community boards here around having a remote site, like kind of the food truck model of, are you still doing that?
Yeah.
And is there one in Queens, and can we reach out to you to get that to come to our neighborhood?
Mm-hmm. Yes, please reach out to me. We'd love to be in touch and would love to hear where you think it should be. We have several of them. And it used to be, this is a little more information, but I'm proud of what we're able to offer New Yorkers. We used to have vehicles that would travel around and set up in sort of tents. We now, knowing that the coronavirus would be here this winter, have weatherized mobile units. There are many of them sort of look like former ambulances that we have staff in the units that we could do in rain, shine, snow, you name it. So we will be there for you, weather aside. We've been planning for this for a long time. We will never stop testing as long as we need to for the coronavirus.
So at one point, someone had indicated that you could have a mobile test site for 2 weeks, or, like at a train station, at a subway stop. Is that something you're thinking still? I mean, if we wanted a mobile site at a subway station on the 7 train, is that something that we could work with you to get?
Yeah, let us know where we should be. We are at the train station now.
Great, thank you.
You're welcome.
Thank you, Dr. Long. And let me just add on that, community boards play such an instrumental role in our communities. And I would love if, perhaps you and DOH are sending out, weekly blasts to them so that they can get that information out. So if you don't have, I know Intergov is on, but if you don't have their emails, you should certainly circle back to us so you can have all of the cheers emails, and so that they can get this information out. Think of them as ambassadors to you, to getting the word out. And on average, I mean, they're dealing with dozens of community board members who all play vital roles in their community, could spread it to their networks. So I think the community boards are often downplayed, but they have a central role to play, especially when we need to disseminate information, and we should utilize it more wisely. They can often get to a network of people quicker than a lot of other folks, even agencies, I'm sad to say. But use them, they're a tentacle to you. So really utilize them. And if you can make sure that we're getting that information in a timely manner as well, we'll disseminate it out as well. So I think Betty made some good points on there. Are there any more questions? Okay, let me see. I'm going to the chat. Any more questions?
I just dropped into the chat, by the way, where all of our mobile vans in Queens are this week, in case folks are curious. And then I heard the point earlier about having longer lead time into these. I think, one of the great things about this program is just how nimble it is. But part of what that means is that sometimes there's a bit of a delay on when we can finalize the schedules. And so, I know this balance we've been trying to strike the whole time between being in the places that really lack testing and need it, and, making sure that people have enough time to learn about those sites. So it's why we try to generally keep the mobile vans there for a week or a weekend. We do try to, as soon as we have the schedule locked, we try to put it up online and send it around to elected offices. We can definitely add community boards to that distribution. But I would just say that part of the reason, I think folks are not used to government moving so quickly. And so perhaps it's a backward compliment.
That is true. Let me offer Borough Hall. And I know you used to have a testing site outside here, and I heard it was removed. And I think it's just a central location that a lot of people could get to. And I want to open, we have a large perimeter here. We'll be more than willing to host. This is the people's house. And we're willing to be a strong partner there. And we have 3 agencies in this building, actually. So it would do well to even test a lot of the staff members who come in. I mean, not that everybody's working, but those who are coming in, including DCAS workers and others. So it could serve a really good role, I think, in being a solution to this issue.
Let's definitely talk about that.
Yeah, let me get back to, I think CB6 has another question on pediatric vaccine. And I have a 5-year-old, so I'm definitely interested in this question.
Yeah, thank you.
Vincent, is it you, Vincent? You have a question? No? Oh.
Borough President, this is Chelsea Cipriano from the New York City Health Department. I'm happy to speak to the children question if helpful.
Great.
So, sorry, I'm balancing a couple of things with some very bad internet right now. I apologize, everyone.
You're doing all right.
Let me just get this set up. Apologies. I am indoors in an office setting and 6 feet from others, but still wearing a mask. I want to bring everyone's attention to that.
Yep.
And ask you to please do the same. So we do not, the initial vaccination will not be available for children.
You muted yourself. Let me see if I could unmute you. Chelsea, you're muted, or either we
Okay,
lost
I
you.
think I got it now.
Right, all right,
Sorry
you're
about
back.
that.
Okay, now you're back.
Sorry, I was trying to unmute myself and I think I was additionally muting myself. So yeah, so as I was saying, I'm sorry. So the vaccines will likely not be initially authorized for use in children. Pfizer's emergency use authorization, which is what was just approved this last Friday, just hot off the presses approved. That applies to ages 16 plus. So the vaccine will likely be available to younger New Yorkers in later phases of the distribution. So not just yet. Most of the trials have been focused on adults, but we expect other companies, additional companies to start enrolling children in clinical trials in the coming year. But we're staying tuned and trying to stay informed, and so that we can keep you all informed of the latest information. We know you're eager to get it.
All right, we're going to go to the chair of Community Board 9, Mr. Wilson.
Thank you, Borough President. Yes, I'm looking forward to maybe adding a couple of sites, like in Councilman Adams' district and Betty's. That Lefferts Library. That's a hot spot because that's a transportation hub, and so is Borough Hall. It's very simple for someone to take the train and get off. I think I only actually have one pop-up site in my entire district of Kew Gardens, Richmond Hill, Ozone Park, and Woodhaven. But what I wanted to bring out is I know a lot of people rush to these sites more so because they see the rapid, that they could actually do their rapid testing. So that's what attracts most of them to those sites. But I was wondering, is there ever in the near future take it home test that you could bring back? Because for example, I had a constituent call me and said that he lived with his elderly grandmother. He tested positive, but they lived in separate parts of the house, and they were really concerned for her, but she was too scared to leave the house. I know that there's a company, Pixel from LabCorp, that offers it, but it's almost $200 to do this. Is there anything maybe in the near future that you guys may be able to offer?
Yeah, this is Ted. That's a great question. So in the cases where somebody is a close contact, so in the example you gave, if the family member is a close contact of the other family member, we'll actually go ahead and mail you a self-test kit that you can do from home, and then you can have FedEx pick it up from your home so you don't have to leave your home. We're reserving those right now for people that are designated as close contacts. And we're looking to think about what we can do to expand for everybody. But in the situation where it's a close contact, that's something we've made available.
How could we request one of these kits?
So the close contact can call 212-COVID-19.
Thank you so much.
So just say that one more time for those listening, Dr. Long.
Sure. 212-COVID-19.
And who gets priority on this again? If you can say that one more time.
So these are we'll mail it to you if you're a close contact, meaning that you've been within 6 feet for 10 minutes or more of somebody that's a case or somebody that has coronavirus.
Okay. Thank you. I think I said Dr. Breton.
I'm glad. I realize we have plenty of time before anybody's going to get to the point where we're vaccinating children. But probably Vinny, Karen, and I are the only 3 people in this crowd old enough to remember when the Salk vaccine for polio first came out. They mass inoculated everybody in school. Are there any plans down the road to do that type of a program?
I think that's for you, Dr. Long.
I wish I could answer that for you. I'll have to defer to the Department of Health with
Yeah, that would be a health question, really.
All right, okay, got it. All righty. All right, let's pass the buck. All right, let's go. Who's on DOH?
But they got us all.
Smart answer, Dr. Long. Way to pass the buck.
To add on to Betty, we remember when you went to grammar school, they just kept punching you full of needles with or without your parents' permission.
Right.
On my block got polio, and they took all.
Yeah, and then the polio. I lost my cousin to polio. Kids were dying daily in the 50s due to polio,
Right.
and we had nothing to start with. And then they developed it, it was just, you had no choice, just do it.
Right. All right, you want to go, Chelsea? You want to take a shot at that?
I have to admit, I missed the end of the question and came in for that rousing conversation afterwards.
Go ahead, Betty.
What was the actual question?
Question was, do we have plans to inoculate children in a
Sure.
mass inoculation program?
Sure.
And then if we get to the point of children.
Yeah, no, I thank you so much. I think that the goal is obviously to vaccinate as many New Yorkers as possible. That's why we're trying to make it as easy as possible and free from barriers as possible. That being said, I can't speak to the vaccine development until we hear more from the federal government and from the vaccine developers themselves. So I don't want to give their news away, but I think we're waiting to hear more on the children's front. And I hear you loud and clear. I hear the point about polio. It is a point well taken, and thank you.
Thank you. All righty. Any other last questions, comments, or concerns?
I can respond to this comment in the chat box too. For the person who said the Sunnyside Community Service Center, if you want to shoot me an email, I would love to talk about that. In terms of the train stations, we've done these in Penn Station and Port Authority.
Speak a little closer to your mic. We're losing.
Oh, sorry, guys.
Mhm.
Is that better?
That's good. Mhm.
Okay. We've done them in Penn Station and Port Authority before. It's a little bit of a jurisdictional tango because we are not the MTA, as one person is very famous for saying. And so it's a little different to do the train stations, but happy to talk about the Sunnyside community service.
Yeah, hi, sorry, it wasn't in the train station. It was under the elevated train, which really would serve Sunnyside Community Services and LaGuardia College.
Gotcha. Okay.
So, you have a lot of kids getting off there and going to school, and you have seniors down the block who, and healthcare workers who, because they have home health aid workers going to Sunnyside as well as others. So that would be great location. So we can talk about that.
And you're saying you have capacity to expand more testing in Queens, correct, Dr. Long?
All I want to do is expand testing.
Perfect. Okay, good. So we took a lot of locations, and if you have suggestions, I have Brent Weisberg from my office on. You could wave, say hi, Brent, and you should please, we should all let's not overwhelm them with 20 different emails. Let's centralize emails so we can send one out tomorrow. So if you have locations, please get that to Brent, and then we could send those suggestions over to Dr. Long as well. And testing is critical. And let me just commend HHC for the work you've done on testing. I've been tested several times. I don't go in and say I'm an elected official. I don't, I went and got tested even in Kew Gardens last week. I was down the block from the office, going home, and the professionalism of your staff is to be commended. And also it's very important when people are nervous and have that anxiety. And even I get that, right? Going to get tested. I don't know a person who doesn't have somewhat of some anxiety when they go to get tested, but your people are really accommodating and really professional. And I think it eases, the anxiety we feel. So I want to commend you and the staff and just give a shout out to all of the HHC staff who I've gotten to meet along the journey. Thank them for their professionalism. So go get tested, Queens. I mean, there's no excuse not to. It's free. I know some of you, I think we've heard, are going to these urgent care centers, and I'm not taking anything away from urgent care centers, but you got free testing being done by the city. You don't have to wait online for 20 hours. You even got an app that they're going to promote more, of course, that you can see, that will show you in real time when you can go and get tested and what those lines look like. So really take advantage, and I really urge everyone to get tested. This is a key strategy. Even as its vaccine comes on board, as Dr. Chokshi said, it's still key that you get tested to keep your family and community safe. So I just wanted to stress that as well. If there are any more comments, questions, or concerns? I'm looking in the chat box now. All right, seeing none. So we got a game plan moving forward with our community boards. We're gonna all give suggested locations if you have to. If you have testing, you don't have to go and create and make up, but if you don't have tested or there are gaps in your community, please get those over to Brent so we can get those over to the Department of Health and to test and trace.
Yeah, I just want to say something about sort of the spread of testing as it exists right now, because there are certainly a lot of sites and a lot of sites in Queens. And I think one of the unfortunate advantages that we have this time around is that we saw which communities were particularly hard hit in the first wave. And so we worked to create a program that really served kind of, no barrier, easy to access testing to areas that were particularly hard hit. And so that's really been a focus of ours that I think we're all proud of. We kind of refer to it as like the equity agenda here. And I think it's something that we were able to take out away from what was such a horrible, dark moment in our history and try to really plan in a way that responded to that directly.
Thank you for that. And that certainly is important moving forward. And, I can't stress it enough. The communities hit hardest. If you don't take care of the most vulnerable amongst you, you could never stop a pandemic. And I think that that's been proven, that's shown already through the communities that were hit hardest in Queens. So with that being said, I want to thank each and every one of you for coming out. I want to thank the public, all of you who joined us for my first borough board meeting on such a historic day. I want to thank Dr. Chokshi once again for joining us. I know he's had an agenda-packed day, and I want to thank him for taking the time out. Dr. Long, always a pleasure to work with you and see you. We look forward to more testing sites in Queens, and to my colleagues, Adrian Adams and Karen, and to all of our DMs and chairs. I just want to thank you for the work that you do and the work that we'll continue to do. So thank you all for attending the Borough Board.